CMS has updated the CPT codes for Transitional Care Management for 2024. In this video, we'll discuss everything you need to know so you can properly code and bill for this program. Hi, this is Jared from ThoroughCare. Here at ThoroughCare, we specialize in helping practices manage, bill, and streamline reimbursements for value-based programs like TCM with our care coordination software. If you'd like a reference guide for the TCM CPT codes that we'll cover in this video, you can download one from our website. There's a link in the description below. For 2024, there are no major changes to TCM rules and regulations, but there are updated reimbursement rates for the CPT codes. Keep in mind that the codes are based on national averages, which may vary in your area. For the exact current rate, based on your location, visit the Physician VE Schedule website. TCM provides support for patients in the first 30 days after discharge. The goal is that the patient avoids readmission and has a successful transition home. If a patient is not readmitted after 30 days and the 3 segments of TCM have been completed, including interactive contact, the non-face-to-face services, an official office visit, billing can commence. There are 2 CPT codes for transitional care management, and they are based on the complexity of medical decision making. Only one code can be billed per patient per program based on the complexity. So what goes into determining the complexity of medical decision making? How many possible diagnoses and/or the amount of care management options need to be considered, the complexity of medical records, tests, and other information that needs to be acquired and analyzed, or the risk of significant complications with the patient's conditions. It's ultimately up to the provider to determine the level of medical decision making and to bill one of the following codes. The first CPT code is 99495 for moderate complexity in the medical decision making. The patient will need to be outreached within the first 48 hours of discharge, and the face-to-face office visit must occur within 14 days of discharge. The national average reimbursement of 99495 is $203. The other option is to bill for high complexity in medical decision making with the code 99496. The patient will still need to be outreached within the first 48 hours of discharge, but the face-to-face office visit will need to occur within 7 days of discharge. The national average reimbursement of 99496 is $275. One thing we didn't mention is low complexity in decision making. For TCM, you cannot bill for low complexity. However, we at ThoroughCare strongly recommend you still complete a TCM for low complexity of decision making patients. Having a completed TCM will help make sure your patient has a smooth transition home and also add to the value-based offerings at your practice. So there you have the 2024 updated CPT codes for transitional care management. If you'd like to learn more about TCM, its rules and regulations, or its billing codes, watch more videos on our channel or visit our learning center. There's links in the description below. And don't forget to download your free reference guide for the billing codes we discussed in this video. Please like and subscribe. Thanks for watching.